Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, November 24th. We're joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate are also with us today. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any of the reporters are having a problem, please email eco@gov.yk.ca. Premier Silver?
Thank you very much, Pat. Good morning, everybody, and thanks again for joining us here on the traditional territory of the Kwanlin Dun First Nation and the Ta'anquatchin Council. I would like to start today, as I have many days, by thanking Yukoners for their continuing practicing of the Safe Six and for their sacrifices that they are making to keep us all safe. Yesterday, we announced new COVID-19 cases in the territory, which brings our total case count to 38. We also issued a public notifications for various locations in Whitehorse over the past several days. I'd like to quickly review what a public notification means so that we're all clear on why these notifications are issued. We issue possible exposure locations so that anyone who was at that location at that time knows to monitor for symptoms. It is very likely that the businesses or other facilities identified have been following the rules, and public notification is not intended to suggest that there's any danger at those locations, nor is it intended to shame anyone who was at those locations. Please remember that the purpose of notifications is to help you know if you've been exposed. If you were at one of those locations, please monitor for symptoms. Anyone who has symptoms should self-isolate, take the online self-assessment, and also call 811 and arrange for testing at the COVID-19 Testing and Assessment Center at 867-393-3083 or through the Rural Community Health Center. We must stay vigilant and stay calm. Our health system is well prepared to deal with COVID-19 cases in the territory, including our capacity for testing and contact tracing. We have added an additional temporary testing space beside Centennial Motors on the Alaska Highway across from the airport. Yukoners can go there if they require a test. It's a drive-through testing spot so that you can stay in your vehicle while being tested. Over the last 7 days, we have seen Yukon's total case count increase. It is accurate to say that we are in our second wave. Because of this rapid increase in cases, and on the recommendations of Dr. Hanley, we are making masks mandatory. As of December 1st, it will be mandatory to wear a non-medical mask in all indoor public spaces. This will extend to all Yukoners over the age of 2, with very limited exceptions. Following the Safe Six, with the addition of wearing a mask, is the best thing you can do to continue to curb the spread of this disease. The Safe Six has just got a +1. Make no mistake, we must all take these precautions now so that we do not see case increases exponentially and rapidly throughout the territory. As I said last week, we are at a turning point. It is time to reset our behaviors and to take extra precautions. We must renew our commitment to practicing the Safe Six, limiting indoor gatherings to 10 people, keeping distance, staying 2 meters or 6 feet away from people who are outside of your household bubble, washing your hands frequently. It's also a good idea to sanitize shared surfaces regularly as well. Travel respectfully if you are leaving your home community. Self-isolate if required, including if you have just arrived in the territory or are returning to the territory. Monitor your symptoms and stay home if you're feeling ill. I think we are all very sensitive to symptoms these days. Be careful. Stay home if you're feeling any COVID-19 symptoms at all. We are all in this situation together, but we have to control what we do ourselves. The Safe Six are things that we can do individually to protect ourselves and our communities. Now, last week we laid another charge under the Civil Emergency Measures Act for failure to self-isolate. This brings the total number of charges under CEMA to 26. As I've said before, self-isolating is not a suggestion. It is not something you can choose to ignore if it's inconvenient. Self-isolation requirements are in place to prevent the spread of COVID-19 in our territory, and you must take them all seriously. When you fail to self-isolate, you put your friends, your neighbors, and your colleagues, and your fellow Yukoners at risk. Please do what you can to support each other, including those who need to self-isolate, whether it's picking up groceries or other supplies or dropping off meals. These are challenging times, and we need to help each other so that we can continue to stay safe and healthy. Another thing that you can do is to check in on your own social bubble to make sure that it has not grown bigger than it should be. Social bubbles should not be any more than 15 people, and even then, indoor gatherings should be limited to 10 people. I know that this isn't easy, but I also know that it's incredibly important. We all have a role to play to minimize the spread of COVID-19 in our territory. We also each have a role to play in minimizing the spread of misinformation as well. It is vital to be properly informed about what is happening in our territory and what we can do individually to keep Yukoners safe. I have talked about rumors before, but it bears repeating. Rumors can spread very quickly and can cause unnecessary panic, distrust, and resentment. Again, this is not what we need, and it doesn't help us to keep each other safe. I encourage all Yukoners to stay informed about COVID-19, and to do that, accurate, up-to-date information is always available on Yukon's website, yukon.ca. This is there so that you can find out about the active cases and any risk to the public. We will continue to share information as it becomes available to keep you informed about what is happening in the territory. If you're unsure, again, please check yukon.ca. These weekly briefings are also an important source of accurate information, so thank you again for tuning in today as you do each week. Last week we ended the mobility bubble with BC and the other territories. And I know that this has caused stress for individuals and for businesses who now have to change their plans. The requirement for all individuals entering the territory to once again self-isolate for 14 days can also have an impact on work. Our government has paid sick leave rebate program for employers, including those who are self-employed who are affected by COVID-19. We also have relief programs for Yukon businesses and essential workers who may need support as they deal with the pandemic. You can apply for these supports online at yukon.ca or by reaching out to the team at Economic Development. Yukon government is here to support you through these very challenging times. Our government and the incredible team of public servants who are working so hard to keep services and supports available for Yukoners is still working incredibly hard. This includes the amazing team of educators, as well as school-based and central administration staff who are keeping Yukon schools open. A big thank you to all the folks in the education team, including the janitors, the bus drivers, the folks that are clearing the snow, the administrative support. It truly does take a whole community. And so there's so many people that are contributing to this effort. My most sincere thank you to everybody. The health and safety of our students maintains as the #1 priority as we continue to move through this school year. I would like to take a moment again to thank our teachers and the school administrators for their incredible hard work and dedication during this extremely stressful and unusual year. Thank you. I want to thank the students who have been so flexible and adaptive over the past few months as we work hard to keep them safe. I appreciate that there are some questions about how our education system will respond if there is confirmed cases of COVID-19 in our schools. School operation plans are unique to each and every school. They are prepared with the guidance of the Office of the Chief Medical Officer of Health and support from the Education Department. These operational plans also cover how schools will respond if staff or students develop symptoms of COVID-19. If there is a confirmed case, the Yukon Communicable Disease Center, the YCDC, will identify and directly notify anyone who has been in close contact with that case. They will provide direction on who should stay home and self-isolate. A confirmed case will not necessarily mean a school will close. YCDC will provide direction on who needs to stay home and isolate, which may include specific classes or groups of students. YCDC will also determine who needs to be notified within the school community while still ensuring the privacy and security of personal health information. YCDC will notify parents directly if their child has been exposed, as well as school administrators on a confidential basis. The school administration does not notify other students, staff, or families. YCDC will. Again, the best thing that we can do as individuals, whether you're students or general population, is to practice the Safe 6+1. Finally, I'd like to take some time today to update, on today's update to thank Yukoners. Thank you for those who are working every day on the front lines. Because of you, Yukoners can still buy food, they can get their mail, they can enjoy their favorite sport, they can have a delicious dinner at a local restaurant. Yukoners can still get medical care, dental work, haircuts. We are able to shop at the many fantastic local shops and craft markets recently opened for the holiday shopping. And at the same time, please keep in mind that many local businesses have adapted to COVID realities. Many stores and restaurants now offer online shopping and curbside pickup so that you can shop from home. These and other creative solutions are helping Yukoners limit their times in stores, but buy local and also keep each other safe. Thank you to these businesses for adapting and for keeping Yukoners safe. It remains important to support local businesses, now more than ever. But please do so safely by following the Safe 6 and by wearing a mask. The work that you're doing, that you're all doing, Yukoners, is so important. And so I thank you. I thank the business owners. I thank everybody in the community keeping all of these shops open. We have come so far, yet we still have so far to go. Please, again, be extra patient with each other, be kind, take care of one another like you do, Yukoners. This is a stressful and uncertain time for all of us, and everyone is managing it differently. Practicing the Safe 6 and wearing a mask, not just for yourself, but for your neighbors, for your friends, for your colleagues, for your Yukoners. Be vigilant, and we can keep Yukon in a situation with low COVID-19 cases. By being kind and supporting each other, again, Yukoners, we will get through this. I'll pass things off to Dr. Hanley to share more information about Yukon's current situation. Ganashjish, Masi Cho. Thank you very much.
Thank you, Premier Silver. Dr. Hanley?
Thank you, Premier. And thank you for all your comments, and thank you for all your thank yous. And I think just the broad range of people the Premier was just thanking. I noted public servants, educators and students, people coming forward for testing, businesses and business owners. It just reflects how the pandemic solution is a community solution, and that we are all part of the solution. And the other element I really, again, notice is how we are at a turning point, and how many turning points we've had in this pandemic. And here is yet another turning point towards a pathway where we know there will be an end, there will be a solution, and to something that we will get through. But we need to start by acknowledging how stressful and emotionally draining these last few days have been for all of us. we saw a significant change unfold before us with lightning speed that has left many of us still taking the time to process. We had a number of confirmed cases that have left many people anxious to know what was happening. And only last week, the Premier and I noted that Canada's second wave was likely to hit Yukon as well. In many ways, it was a matter of time until this second wave in Canada affected us. But control of this pandemic is still within reach, and we must focus our efforts on the goal of keeping COVID to a minimum. Yesterday, I spent some time explaining where we were with the cases, and today I'll give a brief update and then move on to some other themes. As the Premier said, as of this morning, we have a confirmed total of 38 cases, bringing the territory's number of active cases to 14, plus the 2 probable cases that I described yesterday. I will tell you that one of those probable cases will be converted into case 39, most likely later today. So there will be no surprises if there's an update to case 39. It's really one of our 2 probable cases that we are just expecting confirmation on a test. The most recent cases, 32 to 38, are all self-isolating at home and doing well. As the Premier mentioned, there have been additional public exposures, and we have posted notifications, and I'll just go over them quickly. In Whitehorse, Canadian Tire, and the Wykes Independent Grocery on November 17th. The Starbucks on Chilkoot Way between November 12th and 18th from opening to closing times. Tony's Restaurant at the Sky Hotel on the Alaska Highway on November 14th, 5 p.m. to closing. And the General Store in Dawson City for the day of November 15th. There were also flight notices posted, and Air North has graciously also circulated these postings on their website, and these cover a number of different days as well. So again, if you're experiencing any symptoms and you've been at these locations, please arrange for testing or even drop in at the drive-through testing center located at as the Premier said, at the Centennial Motors on the Alaska Highway across from the airport. And as the Premier said, we need to remember that because a public exposure notice is issued, it really is giving that extra alert. It's just saying that there was a potential for transmission within a particular setting. It doesn't say anything about the setting itself, except that it's a reminder that there's a possibility that there may have been exposure in that setting for the times posted. And is issued to notify Yukoners to self-monitor for symptoms if they have been at those locations during a time that it may have overlapped with an individual who has tested positive. So when you do see that you've been in one of these places, you lay low, you reduce your public outings, and you self-monitor. But that does not mean that you need to go into self-isolation. And I think it might be useful to review when you should go into self-isolation. And that's when you have symptoms. And if you have had a test and you're waiting for results of the test. If you've returned to Yukon from travel outside the territory within the past 14 days, or if you've been instructed to self-isolate by the Testing and Assessment Center, by YCDC, by community nursing, or by your healthcare provider. And again, as the Premier said, when there's a public notification, this does not mean the business needs to close down either. If there is a positive case connected to an establishment, Yukon Communicable Disease Control will determine what contacts need to stay home and self-isolate and what the next steps are for the business. In the meantime, please be patient. Please don't vilify or avoid businesses that don't shut down. If they remain open, it's because there is little or no risk to doing so. A little more on the cases and the outbreak. After evaluating the new cases that have been confirmed, we are continuing with the declaration of 2 outbreaks. Now, an outbreak is not a cause for panic. An outbreak really means a sudden increase in cases that we have been seeing. And it does mean that we're also putting extra time and resources into managing the outbreak. So the outbreaks are as follows. Outbreak A, which involves cases 24, 25, 28, 33, and 34. And our cases 29 and 27, which we identified as a cluster, are most likely linked to outbreak A, although we haven't established that with certainty yet. And outbreak B, the other outbreak, involves cases 26, 30, 31, 36, 37, and 38. And case 32, as I said yesterday, is unrelated to the 2 outbreaks noted. So we're currently treating these as separate groups, but as I say, there are probable links between at least 2 of them and possibly between all 3. So how did this happen? This has been a question, of course, on a lot of people's minds. And think of an outbreak or outbreaks as requiring first an introduction of infection and then spread of infection. In these outbreaks, case 28 has been related to out-of-territory travel. That was the introduction. Through no fault of this case, there was inadvertent spread to 2 other individuals, resulting in transmission to others, either in household or work settings. Meanwhile, in the case 26 cluster, there was transmission in a shared household. Case 26 transmitted the illness to other individuals within that same household. The source of origin for this case is still being explored, but we, as I said, suspect that there is a link between the 2 clusters with a common transmission site. Case 27 to 29 also likely had a link, as I said, to being in a shared space in one of the settings that we've identified in our public exposure notices. We're keeping a close eye on these cases, of course, and as we get closer to understanding all of the threads of transmission, I will bring back a more detailed description of the outbreaks. I've seen much speculation about community transmission, and indeed, we have to be concerned about that there's a significant risk of this occurring. But we're not there yet. To reiterate from yesterday, community transmission is said to occur when we have a number of cases where the source of transmission is not known. In the current situation, there are links to households, common settings, and workplaces for the majority of cases, and for the few others, contact tracing is ongoing. We have not ruled out community transmission, but at the same time, we still see no evidence of community transmission, in that all cases to date have a defined or suspected link to travel or to cases in themselves linked to travel. So, of course, our efforts to contain this outbreak are going on. With proper self-isolation, our increased testing capacity and contact tracing will allow us to get a grip on these cases. And as this continues, I will continue to release information and advise as necessary. I'd like you to be patient. Our teams are continuing to work through this. The reality of epidemic control is that we are finding out new information by the day and sometimes by the hour. We will likely continue to see changes in the pandemic and the numbers of cases over the next few weeks, and I ask Yukoners to prepare. Now, I don't mean by preparation you need to run out and buy toilet paper. Our stores will remain well stocked, and we're not anticipating any need for locking down. Prepare yourselves more that we may see more cases, perhaps many more. Prepare your mental health by being ready to see worse before we see better. Prepare by ensuring you have a mask with a spare or two when needed. Prepare by starting to think about organizing virtual gatherings this holiday season. Prepare by knowing your social bubble and with whom you are interacting daily. That's the level of preparation each Yukoner needs to invest in. So what does this mean for us ahead? In order to help us contain this outbreak and prevent as much as possible any seeding of COVID spread into the community, changes will have to be made, and this will require us to adjust our routines accordingly. For the next few weeks, I'm advising Yukon residents to keep to your social bubble, whether this is your 1 or your 2 household bubble. This is a time to avoid any indoor social gatherings that do not comprise your bubble members. Keeping to your household bubble is absolutely key during this time, as COVID-19 is just a virus that's hard to control in the winter, and we're seeing that now. Every indoor gathering that we host, every coffee date we have with people outside of our bubble increases our risk of exposure. I'd rather we do this now, in tandem with the rest of Canada, in the effort to contain this rather than months down the road. And please think of that before you go out and socialize with people outside your household bubble. A beer with a neighbor may seem innocent until a chance transmission of COVID occurs. Now, this recommendation does not change orders. It does not change the gathering guidelines that allow for indoor gatherings up to 50 or outdoors up to 100 when the gatherings are seated, organized, and supervised. And guidelines for these sorts of gatherings are on the website and have not changed. What I'm concerned about are those spontaneous household gatherings or parties that occur indoors among people who may be good friends, but who are not in that intimate 1 or 2 household arrangement. Now, regarding travel, we know there is a general recommendation in Canada still to avoid non-essential travel. But we all know that there are a variety of circumstances where travel is required. Celebrations of life, funerals, work-related travel, medical visits fit into that category of circumstances that cannot be avoided. If you have to travel outside of the territory for one of those reasons, please practice the Safe 6 guidelines while you are traveling. Pay close attention to whatever the local requirements are. Stay close to home, work, or your hotel while you are there so that you keep a low profile, limit your outings, wear your mask when required and in any public settings. I would suggest that it is your duty as a traveling Yukoner to do everything you can to avoid acquiring COVID-19 infection and bringing it home. Back here in Yukon is another critical prevention maneuver. If you are sick, please stay home. I know there are circumstances where people still feel the need to go to work if they are feeling ill. I understand that some people do not have the financial flexibility to stay home, and small businesses are fearful of losing staff. But we need to stay home and remember that supports are in place, as the Premier said, to assist individuals who are facing this challenge. The Yukon Business Relief Program provides relief for Yukon-based businesses affected by the pandemic, as well as the paid sick leave rebate for employers, which allows employers to provide any employee with the time to self-isolate or take sick leave as needed if they are affected by COVID-19. And again, this is available on Yukon.ca for more information. And as we've all seen, this virus has a ripple effect. One person who has the sniffles might go to work and infect another employee, who then goes home and infects their household, and so on and so forth. It can happen so quickly, as we have seen with this present collection of cases. It's crucial when you take your symptoms seriously and stay home and away from others when you need to. Due to this welcome increase in demand for testing, and I am happy to see that, we have set up a drive-through testing center at the old Centennial Motors Wash Bay located on Alaska Highway in partnership with EMS services of community services of the government. And this drive-through will provide screening for those who are experiencing symptoms and who requires testing. Testing for this can be arranged through the SeaTac Testing Centre, or you can drop by the old Centennial Soapy's car wash. You will be asked a number of questions, and if you meet the criteria, you will receive appropriate testing. If you are preparing to seek testing at the drive-thru, please make sure you remember the following. Everyone in the vehicle should have a mask. If you happen not to have one, it will be supplied. Please write out your name, date of birth, healthcare number, phone number, and mailing address on a piece of paper to hold up in your vehicle so that the administrator can transcribe that information. Access the drive-thru from the Burns roadside and not from the front, as you would have had to get your car washed. As a reminder, this is not a testing center for asymptomatic testing. If you are symptomatic and require a test, you can visit the drive-thru and receive a test. As I previously said, we're not testing people without symptoms, except in very specific circumstances, under direction from YCDC. With the holidays approaching, questions about the appropriate self-isolation protocols have been coming into my office quite regularly. And with the recent decision to curtail our bubble with the other territories in British Columbia, any incoming visitor or returning resident is now required to self-isolate for 14 days. And since the holidays are coming fast, we want to make sure that people know what their options are when it comes to visits and self-isolation responsibilities. Basically, there are two options. First is if you want to enjoy the holidays with your family, meaning you share meals, hugs, members of your household are then committed to self-isolating with you for 14 days. This will mean that the entire household must stay home, only go outside alone or with the people you are self-isolating with, and not have visitors. If you are the household and your guest leaves before the 14 days expire, everyone in your home will need to continue to self-isolate for 3 days following the guest's departure and self-monitor for symptoms. In addition, you need to check in daily with the guest after leaving to find out if they're experiencing any symptoms. If everyone in the household and the departed guests or guests do not exhibit symptoms after 3 days, then your household is free to return to activities. The other option, and this is best for people who will be with a household who need to continue to work and maintain their daily lives as usual, and this can be done in a shared household as long as the guest has a separate bedroom and preferably a shared bathroom. And this means that there's no overlap between the guest and the household. So again, instructions are on the website, but there you need to stay 2 meters away from other household members who are not self-isolating. Use a separate bathroom if possible, and if it's not possible, then the bathrooms need to be cleaned at least daily. You cannot share household items. You cannot share items such as drinking glasses, cups, eating utensils, pillows, other items that would lend themselves to sharing virus as well. You can't eat meals together with others in the household, and you need to clean up household items after using them. So I want to highlight that you're still able to host a guest and not self-isolate with them. That's perfectly safe and encouraged, as long as you maintain your guests' appropriate separation for the 14 days. And if you're unsure of how to self-isolate, please refer to yukon.ca for further information. As the Premier said, the Premier announced the use of mandatory masks, and we had previously said we were in that exploratory phase. And already, in the last few weeks, I've already seen a tremendous uptake in mask use in public spaces around Whitehorse and also in the communities. As we continue to see a resurgence in COVID-19 across Canada, of course, there's just a higher risk of importing and therefore contracting the virus. Canadian jurisdictions have taken this risk into account, and many have mandated or recommend mask use in defined public spaces where physical distancing can be hard to maintain. And in addition to the mandatory mask announcement that the Premier just announced, starting this Thursday, November 26, Yukon's hospitals will implement recommendations from our office by asking all members of the public to wear a mask when they arrive at the hospital. Yukoners can also expect to see hospital employees, physicians, and contractors wearing a mask at all times in all public areas of the workplace. Of course, the risk remains low. The hospitals wanted to be aligned with the territory's approach that recommends people wearing masks in public indoor spaces, and this will allow us to maintain Yukoners' confidence and comfort level while in the hospital. Now, I recognize the benefit of masks and how they are now seen to play a crucial part in reducing the exposure risk from an infected person and reducing the transmission of COVID. I also know the use of masks alone cannot stop the spread of COVID-19. They work best as the seventh step to the Safe Six. So the mandate of masks, as the Premier said, will be moving forward starting December 1st, which will require all individuals over the age of 2 to wear a mask in defined public spaces. Right now, we need to be vigilant in the precautions we take. Introducing the use of non-medical masks into our daily lives is in the interests of the protection of the health and well-being of Yukoners in the territory. So we'll continue to provide updates on mandatory mask use as this progresses. For the time being, I highly recommend wearing a mask when you're unable to physically distance or when you're asked while in a public space. As we said at the beginning, we're in another challenging period in Yukon, and this is another time when we will likely be thrown curveballs every day, and we will just have to meet those challenges, stick together, and keep on living. We know how to do this. The Safe Six is our weapon, and now, with masking as the 6+1, these will work to limit the spread of COVID in Yukon. We will get through these current outbreaks with continued aggressive contact tracing and testing if people do the right thing. Safe Six, let's go over it again. Maintain physical distancing, keeping 2 meters away from everyone who's not a member of your social bubble. Wash your hands frequently with soap and water, or use hand sanitizer with at least 60% alcohol. Stay home if you're feeling sick. Follow the social and organized gathering guidelines and respect the limitations on group size. And as I say, extra attention to that particular step on social gatherings, sticking to your household bubbles only for the time being. Limit travel to rural communities and be respectful when you're there. Self-isolate if you've returned to Yukon from outside in the last 14 days or if you've been directed to by public health. And wear your mask when required to or when physical distancing is challenging. We are in a time when vigilance, kindness, generosity, calm, confidence, and patience will prevail. I just want to correct something I said yesterday, which was a mistake, and that's about a child associated with a daycare, with being in daycare. That wasn't true. It was actually an adult case who is associated with a daycare, an adult staff of one of the daycares. We, through YCDC, are in very close touch and working with that daycare just to handle, again, the usual process, very similar to what the Premier outlined for the schools. It's under control, and all the appropriate contacts have been made in terms of notifying the parents, working with the daycare, and so I have no concerns there. And that's all for my update. So thank you. Remember to take care of each other and to stay well. Thank you. Merci, Joe. Merci.
Thank you, Dr. Hanley. Excuse me. We'll move now to the phone line, and we'll begin with John from CKRW.
Hi. I'm wondering what exactly this mask mandate starting on December 1st will look like for those who work in tight-knit environments such as an office, a restaurant, a local business. And I'm also curious about sports, mainly ice hockey, indoor-related sports and organizations.
Yeah, I'll start, and I'm sure Dr. Hanley will have some things to add as well. So mandatory non-medical masks in public spaces, and so this includes masks that are 2 layers, ideally 3 should be. It should be tightly woven fabric, such as a cotton or a linen. A 3rd middle layer should be a filtered type fabric as well, but again 2 layers at the minimum. It should be large enough to completely cover your nose and your mouth and your chin. An example here of my beautiful mask that I have that does that, 2 layers here. It does have an insert as well. It also should allow for easy breathing and securely fit over the head with ties around the ears. So all public defined places will require the use of non-medical masks. This includes shopping centers, service businesses such as mechanics or cleaners, personal care services such as hair salons, common areas and hotels, convention centers, community and recreational centers, public faith gatherings. Sorry, Mary, I'll slow down a bit. And other publicly shared spaces. Now, again, a full list will be made available on yukon.ca before December the 1st. So we're getting some time out there before folks go to this new normal. As you listen through the list of places that I've listed off, many of them already have mask provisions in place. Recreation centers like the Canada Game Centre, for example, hair salons, bless you, hair salons as well, and things like that. Like we see this as becoming more and more normal as businesses have been doing excellent work remaining vigilant on Yukoners' safety. When it comes to exemptions, children under the age of 2, as I mentioned, will not be required. Other exemptions, like people who have medical conditions which prevent them from wearing masks, will be exempt. People who are participating in sports, in the private areas of long-term care homes, or are eating or drinking in a public restaurant will also not require the masks at those times. But again, a list of the exemptions will be available on yukon.ca before December 1st. I hope that answered your question. If you have a follow-up, then, or Dr. Hanley, if you want to add something to that.
Whew, it's hard to add much to that. I can't believe the Premier's memorized all that already. I only have the 2-layer mask. So the type of mask, is, again, that will come more in the recommendations. You know, what's the ideal mask? But that's not a part that's going to be, you know, no one's going to be pulled aside because they only have a 2-layer mask. Or, but I think it is important to understand what, you know, how a mask is most effective and how it should be worn. Yeah, I think that covers the basics. I think I just wanted to, without going into more details, which the Premier amply covered, it's really about recognizing masks as an additional layer. And so all of those other layers are or should be already in place. And so you asked about workplace, for instance. So this is an additional layer for common spaces where there's mixing with public that may be in a workplace. But that's added on to what is the operating plan, the business operating plan for the workplace. So you know, how many people in a meeting room, the sanitation protocols, the spacing, the people not showing up when they're sick, those are all the fundamental layers to which now the mask usage is added on to as a requirement for where there are those common areas where there's mixing with the public. And similar with sports and activities, as you know, mostly over the summer, we published all of those guidelines about activities and how to do certain organized sports like hockey and indoor sports, and And so we will not be expecting mask usage during the activity. It's more in those areas where there's mixing, recommending the addition of mask use to the other established guidelines.
Thank you. Do you have a follow-up question, John?
I do. I'm curious as to mask availability and, I guess, limitations in that. If someone doesn't have a mask and they're unable to get one through a local store, or they can't afford one, or some reason prevents them from getting a mask in a traditional sense, is the government or some public entity going to be providing masks to those who need them?
We don't have a policy right now for providing masks. Our focus when we were negotiating with the restart funding from the federal government when it came to PPEs was on masks for our medical community, for our health and social services providers, those types of things. We have noticed, again, a lot of businesses have, in the past, have had masks available for folks, but at this time there's no government policy to provide masks for the general public.
Thank you. We'll move to our next online reporter, Philippe, CBC Yukon.
Dr. Hanley, yesterday we mentioned there were 2 cases of children under 9. You've issued this correction on the daycare. Is that still the case, that there are 2 children among the active cases?
Yes, yeah, that's true. So their households with their household contacts of one of the cases that became cases themselves. One of those is a probable case, and one is a confirmed case.
Follow up, Philippe.
We just yes. Could we just define public space? Would that include space like a sidewalk? Is it only within private businesses? What is a public space, please?
Yeah, well, maybe I'll start and the Premier can correct me. But so for one thing, we're talking about indoor spaces. So it's quite clear that really the concern is about indoors. And as far as outdoors, all of the usual guidance about spacing and gathering, I think are sufficient to take care of the much reduced risk of transmission in outdoor settings. So that's one thing to clarify. So no, when you're on a sidewalk, you try to observe the spacing, but you don't need to wear a mask. So it's really, think of indoor settings where there is mixing with public. And again, this is all going to be clarified in the policies as they're published. But it's in where you have a place where you're providing services to the public, then that's where the mask usage will be prescribed.
Yeah, not much more to add on that. Dr. Hanley nailed it. This focus is on public places and buildings. What I've noticed, just I want to, well, first I'll give a shout out to folks like Mayor Curtis or Mayor Poteroka, other public figures who have said, look, I'm just gonna start wearing a mask in all places. I've been doing the same, and what I've noticed is from the time I leave my apartment, just putting my mask on when I'm out just makes sense to me. I'm not taking it out of my pocket, putting back on, which really is me exposing my face to more touching if I am doing those things. So I put it on when I get in my car, and and I leave it there until I get to desks like this, and it really has been easy to do in that case, as opposed to if I'm on a sidewalk and I know that I can maintain social distance until somebody comes up and talks to me, then I have to find my mask. So I've been just wearing it a lot everywhere that I go. And what I've been noticing too is from the general population is a lot of people are thankful for that approach, because again, Dr. Hanley has said this so many times, the mask is really to protect others, and it's also a sign of respect as well. If you're at a cash register, we know that there's plexiglass and other things there, but those folks that are working on the front line, whether they be in grocery stores or in hospitals or in other areas, up until this mandatory requirement, have been very, very thankful for individuals wearing masks in public places. But we will update the list on yukon.ca before December 1st to clearly define where these public spaces are that the mask wearing is now mandatory.
Thank you. We'll move now to our next reporter, Claudienne, Radio-Canada.
Oui, Dr. Hanley, donc me dire en français la grande nouvelle mesure aujourd'hui et les raisons qui expliquent cette décision-là.
So, Dr. Hanley, could you please repeat the new measures for today and the rationale behind them?
Oui, merci, Claudienne. Donc, le plus grande peut-être nouvelle, c'est l'usage de masques obligatoires, les masques non médicaux, à partir du 1er décembre, dans les endroits à l'intérieur, dans les espaces à l'intérieur où on a les endroits publics, hein, donc où on reçoit ou on mélange avec la public. Donc, il y avait toute la politique et tous les détails à venir prochainement dans les prochains jours pour expliquer les exceptions. C'est pour l'âge de 2 ans et plus et avec des exceptions très limitées. Et c'est pour tout le territoire. Donc, ça, c'est une chose et c'est comme la 7e étape de les 6 étapes, le Safe 6. Donc, c'est Safe 6 plus 1 pour ajouter un autre moyen pour éviter la propagation, la transmission du virus qui est plus en plus entré dans le territoire. Et donc, c'est pour peut-être rejoindre la majorité de pays maintenant qui ont les mêmes projets de loi et pour reconnaître l'accumulation d'évidence que ça joue un rôle important de la prévention de propagation du virus. La deuxième, c'était des conseils, et pas un ordre, mais des conseils pour entretenir les rassemblements dans la maison pour les boules domestiques. Donc, c'est limiter les rassemblements sociaux aux boules domestiques. S'il s'agit d'un domicile ou deux, la limite de 10 s'applique, mais je conseille les gens, la public, pour les prochaines quelques semaines, pour limiter les rassemblements à la maison de la boule domestique.
Avez-vous une autre question, Claudienne?
Oui, vous avez mentionné une exposition, un risque d'exposition à Dawson. C'est nouveau, ça. Pouvez-vous me dire davantage ce qu'il en est de cette exposition dans une collectivité rurale?
You mentioned the possibility of exposure in Dawson City. This seems to be new. Could you please elaborate on it and tell us a bit more of what's going on there?
Oui, c'est bien remarqué qu'on a ajouté un autre élément et c'est une exposition publique, une notification publique pour le General Store à Dawson pour la date de, je pense, c'était 15 novembre. Et il s'agit d'un cas qui est d'origine de Dawson, qui était dans cet endroit pour une certaine période. Donc, c'est aussi pour ajouter au... Il dit pour nous deux choses, que comme les autres notifications publiques, c'est un avis, c'est juste un avis pour les personnes qui étaient dans le General Store pendant ces journées, juste pour ajouter plus d'attention aux symptômes et d'aller pour faire des dépistages si les symptômes arrivent. Et c'est peut-être aussi, je sais qu'il y a beaucoup de communication, de rumeurs, de si des cas viennent de Dawson, qu'est-ce que la situation à Dawson. Et je veux peut-être prendre cette opportunité pour dire que oui, il y a les 2 cas qui viennent de Dawson, mais ils sont la seule exposition publique, c'est cette la General Store. Il n'y a pas d'autre souci pour une exposition publique ou pour autre cas à Dawson, donc c'est très contenu. Et peut-être ça va assurer les citoyens de Dawson que la situation, comme toujours, ça reste sous contrôle. Il n'y a pas autre risque pour le public pour la ville de Dawson. I will repeat that in
Thank you
English.
very much.
Claudienne noted that the notification for Dawson City, so it's kind of an outing that yes, indeed, our 2 out of Whitehorse cases are indeed Dawson residents. And there was one of the cases was in that general store on that date, and that's why we posted that. Again, this is a precautionary. I've been to the general store, of course, myself many times. I know that they are very conscientious about protocols, as I think the whole city of Dawson is. And so it's, again, no particular worry about the setting. It's just a precautionary notice that there could have been an opportunity for transmission. And again, it's that reminder, if you were in that setting, pay extra attention. If symptoms occur, please come forward for testing. And Dawson, the physicians in Dawson and at the clinic and the hospital are as prepared as anyone to receive people for doing a swab and getting the test done. Or if you're now in Whitehorse and you were in Dawson, the same, of course, applies, ability to test if symptoms occur. I think it also had another purpose, and that was just to reassure the city of Dawson that we are not concerned about any other public exposure. We're not concerned about circulation of COVID in the community. I again want to reassure the community to live life as normal, and with all and as a reminder, I mean, I know Dawson has been through this in the summer, but just another reminder to recheck those protocols, to relook at the Safe 6, to take up the mask usage in addition, and that Dawson also we will all get through this together.
Thank you. We'll move to our next caller, Marine Ara-Boréal.
Oui, merci. C'est une question pour le docteur Hanley. Est-ce que les masques vont désormais être obligatoires pour les enfants dans les garderies, ou est-ce que ça reste à la discrétion des établissements?
So the question is for Dr. Hanley. Are masks going to be also mandatory for children in daycare, or does it still rest with parents to make that decision?
Oui, merci pour la question. C'est une bonne question et c'est important pour clarifier que et encore ça va venir avec les détails, mais ça change pas les mesures déjà en place ou pour les garderies ou pour les écoles. Donc par exemple pour les enfants dans la garderie, les enfants n'ont pas besoin de porter des masques. Oui, c'est une option pour les parents s'ils préfèrent. Et dans les écoles, comme on a annoncé il y a 2 semaines peut-être, que l'usage de masques dans les endroits communs sera mandatoire dans les écoles, mais pas dans les classes. Donc ça change pas. Et la limite de masques dans les écoles de 10 ans, ça change pas. Donc les écoles, les garderies sont exception de l'usage de masques. C'est dans les milieux publics. I'll also repeat that in English. So it's just to clarify that the existing guidelines for daycares and schools with respect to masks have not changed. So mask use, as we announced a couple of weeks ago for the schools, will become required in common areas for kids 10 and up, but not within the classroom. And so none of that is changing from this new mandate, and the existing guidelines for the daycares will not change.
Thank you. Avez-vous une autre question, Marianne?
Oui. Au Yukon, la communauté est habituée à faire des rassemblements extérieurs par n'importe quelle température. Souvent, les feux de camp, c'est quand même assez populaire. Avec l'arrivée des fêtes de fin d'année, est-ce que vous prévoyez de changer les règles pour les rassemblements privés?
So in the Yukon, people are used to get together outside for fire camps or other reason. Do you expect to change the rules for these gatherings with Christmas coming and the holidays where people might be tempted to do these activities?
Pour le moment, et comme on a dit, la situation, c'est possible que ça peut changer. Si on reste dans une situation sans évidence, sans transmission communautaire, je prévois de ne pas changer ou de ne pas changer l'avis que je donne au gouvernement pour les rassemblements. Donc, on est très conscient qu'on est en train de limiter les rassemblements à l'intérieur, que déjà les vacances seront très différentes cette année. Et donc, pour encourager les rassemblements bien espacés, bien réglés à l'extérieur, je pense que ce sera un moyen pour les citoyens de célébrer les vacances, les fêtes. Donc, pour la position, ça ne change pas.
I won't ask you to repeat that. You did speak to that in English earlier, so...
That just to add to that question, it reminds me again of the message that myself and Dr. Hanley have been saying a lot. It's now time for us to reset and to readjust our own personal behaviors and practices, and now more than ever, you know, we take these measures, and we're in a situation right now where hopefully, you know, we're in a situation where Yukoners can safely get together over the holidays. Yukoners can safely go to stores. We don't want to roll back. But now more than ever, it's up to Yukoners. And I want to give a shout out to our youth, because we're really relying on younger Yukoners right now to help us get through this. And one only has to take a look on Facebook to my good friend Dustin Phelps Van Bibber's viral post. Over thousands and thousands of views where this young gentleman is saying, well, with a lot more curse words than I'm allowed to use, but step up, Yukoners. Step up now more than ever. We really need you for the safety of our elders, for the safety of everybody else. I can't thank Dustin enough for being an example for other youth, and we need to follow his lead for sure. And if we do, we'll get through this, and we won't have to go back. We'll go forward to the vaccine, hopefully with everybody doing what they're supposed to do. Thanks, Dustin.
Thank you. We'll move to our next caller, Gabrielle, Whitehorse Star.
Hi. Is there an enforcement aspect to mask use at all? And if businesses are responsible for enforcing mask use in their own establishment, do operational plans need to be updated to reflect that?
Sorry, could you repeat the first part of the question?
I'm just wondering if there's an enforcement aspect to mandatory mask use at all.
So right now, we're not considering any additional changes right now. You know, any more information about enforcement will come before December 1st. But again, this is mandatory, so it is a mandatory requirement. We'll give more information about what that means as far as if people refuse. But we're asking Yukoners to wear masks, wear one to protect people around them. We're going to share information about this requirement, and we do have an option to enforce it through the fines if somebody or some business shows repeated or egregious failures to follow the rules. But more information on all that will be out on the website before December 1st.
Do you have a follow-up, Gabrielle?
That's good for me. Thank you.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I also had a question about masks. Premier Silver, it was mentioned that there will be limited exemptions, very limited exemptions for some people with masks. Could you just speak a little bit to what those exemptions might include?
Yeah, again, so children under the age of 2 will not be required to wear masks. People with medical conditions, which prevents them from wearing masks, of course, would be exempt as well. But again, we're looking at situations where people playing sports or in private areas in long-term care homes. If you're at a restaurant, you need to take your mask off to eat, obviously, or to drink. So in those cases, you're within your bubble anyway. But those are some of the situations right now where, of course, you're not going to be able to wear your mask. But for the general population over the age of 2 in public places, it will be mandatory. Again, we'll have the complete list in place on yukon.ca well before the December 1st deadline.
Do you have a follow-up, Haley?
Thank you. Yes, I apologize if this question was already asked. I lost the feed for a minute. But could you just explain the decision to wait until December 1st to make the masks mandatory as opposed to a shorter timeline, I guess?
Yeah, I very much appreciate the question. We want to give businesses, organizations, and other governments time to prepare for this. As we said, please start wearing your masks now. I've seen a sea change over the last couple of weeks in Yukon. People have really been upping their game when it comes to masks anyway. We're asking people, don't wait till the deadline. If you have masks now, this is the new normal and it's coming. But we really want to give some time, we're to help people prepare for what this means, help people to get online and to take a look at the information to make sure that they know exactly what's required of them. Nobody wants to be in contravention of any of the rules. We've seen that all summer long with our helpline. A lot of the people calling the helpline were people making sure that they're doing things properly as opposed to other calls. So again, same situation where it's coming, it's mandatory, and prepare yourself by reading online and knowing how to make sure that you're following the rules.
I'd like to thank everyone for their time today. Our next COVID-19 update will take place Tuesday, December 1st at 9:30 a.m.